Hey everyone, BreeAnn Allred, physical therapist and pelvic health specialist with Yada Yada. We're going to talk about common problems during pregnancy. When we're having pains during pregnancy, most often they're going to be in your low back, your upper back, or within your pelvis. So we've got kind of three major problem areas when we're pregnant, or areas that can cause pain. Now, there's lots of underlying causes for this, but one primary cause is hormonal changes. There's two major hormones that really elevate during pregnancy. One is estrogen, and the other is relaxin. These two hormones give us a lot of laxity in our body. They serve a purpose. It's so that your body can expand to grow and house a baby. And so it serves a purpose, but it also kind of causes some issues because now our ligaments are kind of loosey-goosey. They're allowing for things to change and move in ways that they wouldn't normally. So now your body is not able to rely on these ligaments like it has typically done in the past. Common issues that can come from this can be some increased mobility in the low back. That increased mobility can cause some pain in the nerves or the discs of the low back. And then we've got abdominal muscles, which is also a primary support for our low back, that are now being stretched as our baby is growing. So activating the transverse abdominis, where we can help provide some abdominal support as these muscles are being stretched, can provide a lot of support. There's also ways that you can help work your low back muscles that don't involve laying on your belly when you're pregnant. Next common problem that we have is usually some pelvic dysfunction. Now, with our pelvic dysfunction, these are going to look like some SI joint region dysfunction, which is kind of one-sided low back pain. These problems are really kind of shifting when we may transition out of a car, when you're putting pants on, when you are rolling over in bed, where you get a lot of kind of shifting in the pelvis and it causes some pain. Along these same type of lines, we may see some pubic symphysis dysfunction. And I will say I'm not quite sure why some people have more pubic symphysis dysfunction and other people have more SI joint dysfunction, but it stems from a similar cause. It stems from the pelvis shifting and rotating back and forth with movements that kind of are one-legged or put pressure through one side of the body. Now, this can result in some things being out of alignment. It can just result in poor stability, so you've got some increased wiggle between those joints, and that increased wiggle can cause some inflammation and cause pain as well. So in order to correct these dysfunctions, we're really needing to rely on our muscles instead of our ligaments. So we need to rely on those core muscles, the abdominals, the low back muscles, the pelvic floor, and kind of the upper thigh and buttock region. So if you see a physical therapist for these conditions, they're going to be focusing a lot on helping to strengthen these supportive muscles. Unfortunately, physical therapy is often not a quick fix for pain, but it can provide some pretty amazing results within about 2 to 3 weeks. So I encourage my patients, I'm like, you may not feel an immediate difference right away, but if you're persistent with these exercises and actually get some strength building in these muscles, then you're going to notice some improvements in your pain. So it takes a little bit of time. The physical therapist does have some other resources that can help with helping to eliminate pain short term, but the exercises will provide really the basis for stabilizing these muscles. We're going to go through and show you some exercises that I would commonly prescribe for these conditions. These are exercises for low back pain during early pregnancy up until about the second trimester and early second trimester, because we're going to be doing things laying on your back, which obviously as you get further into your pregnancy, we want to limit that. So this first exercise is going to help activate your thighs and your buttock muscles. We really want to get it kind of into the posterior thighs and buttocks. So I'm going to recommend that you lift your toes up off the ground. And then we want you to put your hands down towards your side. We're going to activate that transverse abdominis. So you're going to really kind of pull those abdominals back towards the spine and that lower abdominal region. And then you're going to lift your hips in the air. You're going to hold for 5 seconds. And then you're going to come back down. And at home, I'd have you repeat that 10 to 20 times based on how your pain levels are responding to that. So this is really to help get kind of upper thighs and buttock, and it will get a little bit of your low back muscles as well. Now, the next exercise that we're going to do is to start activating this transverse abdominis muscle in a little bit more of a challenging way. So you're going to start once again laying on your back. You're going to tighten your stomach muscles, and then you're going to march your legs. And you're going to do 10 repetitions per leg. Okay, so you get the gist there. Now the next one for the transverse abdominis to help as well is that you're going to start in this position. You're going to activate that transverse abdominis, and then we're going to let one knee fall out to the side and come back up. Other knee out to the side, come back up. Now, these exercises can be very easy, but if you're actually really focusing on the transverse abdominis, they're quite difficult to do. Now, with this kind of letting one knee fall to the side, we call it a single knee fall out. We want to make sure that you're not allowing your pelvis to teeter-totter side to side. All right, this next exercise that we're going to be doing is going to continue to work the abdominal muscles, but it's also going to work kind of the sides of our hip muscles and really a little bit of our low back muscles as well. It's called a side bridge on the knees. So you're going to come up on your elbow. We really want to make sure that your spine is straight, that it's not just hanging down. So we're going to straighten out that spine. We're going to tighten the stomach muscles, and then what I want you to do is to lift up and forward. The motion is happening in your hips, so I'm going to have you watch this. Can you see how it's hinging in my hips? Okay, so you're coming up this way. You're going to hold here for 5 seconds, and then come back down, and you would repeat that 5 times, and you'd repeat again on the other side as well. This next one is a way to start activating our low back muscles that's very safe during pregnancy. So first we're going to activate that transverse abdominis by tightening the abdominals, and then you're going to lift the opposite arm and opposite leg. So you're going to reach forward with your arm, backward with your leg, and once again we're trying to not let things teeter-totter. We're trying to hold them nice and strong. Hold for about 5 seconds. You're going to come back down, and then we're going to do the opposite arm and leg. Okay, and at home you would repeat about 10 of these per side. This next exercise is a really nice exercise to help get some mobility and stretch in the low back. So what you're going to do is you're going to arch your stomach or your upper back up towards the ceiling, and then you're going to let it hang down towards the ground. Now, depending how far along you are in your pregnancy, coming upward may be a little bit tricky. And so in this position, what we need you to do is just meet your body where it is. And maybe you can only round a slight bit, but then doing this nice arch can feel really good. And at home, I would have you repeat this exercise about 10 times. Okay, the next one we're going to do is we're going to bring kind of knees out towards the sides just a little bit. We're going to walk our hands forward and then sit your buttock down on your heels. And then you can let the head fall to the floor. Now, if you're a little further along in your pregnancy, you may need a little bit wider knee position and your belly can fall in the middle there. Perfect, and then coming back up. And there's some basic exercises to help early on in your pregnancy with low back pain.